Morning everyone, welcome to episode 63 of A Tiny ADHD Superpower. Today's topic is also very interesting. It's on ADHD and heroin. The co-occurrence of ADHD and substance use disorder is very frequent and has received considerable attention in recent clinical scientific investigations and studies. However, few studies have investigated the prevalence of ADHD in heroin addicts and vice versa. This study aimed to investigate the prevalence of attention ADHD in the sample of heroin addicts treated with opioid agonists, and to report this clinical experience in a public service for addiction. Outpatients over 18 years old and being treated with opioids agonists for heroin addiction were enrolled. Each patient took part in a psychiatric examination and completed an ASRS, which is the Adult ADHD Self-Report Scale, self-assessment. Subjects with positive results were called in for another psychiatric visit, and the Brown ADD scale was used as a second-level test for ADHD. The prevalence of ADHD in this sample was 18%. Among the 20 patients diagnosed with ADHD, 5, or 25%, were female, and 15, or 75%, were male. The most frequent psychiatric comorbidity was major depression, found in 11 patients, which is 55%, of which 4 presented hypomania, such as bipolar disorder. In this sample, making a diagnosis was very difficult. Frequently, multiple comorbidities further complicated these cases. In conclusion, the results of this study are consistent with literature. There seems to be a significant prevalence of ADHD even among heroin addicts. And often the diagnosis is difficult to make because of the combination, and it's just not good for you. We also do not know the exact effect of opioids agonist therapy on ADHD symptoms. Hypotheses have been put forward, but studies are needed. So some of the pretty interesting things I found is in drug addicts, the prevalence of ADHD is estimated to range from 14 to 44%. It increases the risk of relapse even for the greatest discontrol. There's longer duration and greater severity of drug addiction. They have greater polysubstance abuse, as well as lower effectiveness of treatments. In 2017, an Italian multicentric study was published in which 1,057 heroin addicts in opioid treatment completed an ASRS for ADHD. About 19% of the participants screened positive for concurrent adult ADHD symptoms when you're heroin users. Unfortunately, this study only evaluated ADHD symptoms, which are frequent in drug addicts, and did not verify the ADHD diagnosis. This Italian study, conducted with patients in the public addiction service, has the merit of focusing attention on the type of treatment. In conclusion, the results of this study are consistent with the literature. There seems to be a significant prevalence of ADHD even among heroin addicts, and often with diagnosis was hard to make. We also do not know the exact effect of opioid agonist therapy on ADHD symptoms. There's not that much on ADHD and heroin. If I find more, I will put up part 2. Thank you very much, guys. The next episode, it's on ADHD and meth or stimulants. Take care.